Hi everyone, I'm Mary Grace Warner. I'm an MD. I'm an MDH, which means I'm certified in homeopathy. I'm a CCH, certified in homeopathy, and I'm a retired cardiologist. But I've been doing integrative medicine now for many years, probably close to 20 years, and I've been over 50 years a physician. So in my practice, I'm doing about 90% classical homeopathy. I have found homeopathy the most challenging and complex part of medicine that I've ever experienced. It takes all of my left and right brain, and also I've had to develop a strong intuition. It has served me well. I can relate better to my patients. They relate better to me. And I learn all kinds of things about them, which allows me to choose the right remedy. Remedies in homeopathy are not just based on symptoms, they're based on a patient's life and how they're living their life and how they wish to live their life. And I also recommend alternatives for cardiology and do consultative cardiology work. Many of my patients ask me about chelation. As you know, chelation takes up heavy metals. And in cardiology specifically, dilated cardiomyopathy has been shown to take up about 22,000 times as much mercury, that is the heart biopsy itself, compared with normal hearts. And not in the skeletal muscle, just in the cardiac muscle. So there alone is a recommendation for chelation, dilated cardiomyopathy. So anyone with that condition should have a heavy metal screen. In regular allopathic practice, we don't often think of heavy metal poisoning unless we get someone with obvious lead lines and bad anemia, then we might consider lead poisoning. But there's all kinds of heavy metal poisoning. There's arsenic, for example, from herbicides, metallurgy, people working in chemical engineering. There are heavy metals in the beer industry. There are heavy metals in radiology. And that's a recent concern of mine because my colleagues and myself have had several patients who have presented with flu-like symptoms and difficulty with memory and cognition. And heavy metal screens have shown that they have very high titers of gadolinium. Now, gadolinium is a contrast that's used in MRI, that's magnetic resonance imaging to enhance the images. And it is chelated when it's given, but there's enough unchelated gadolinium that it can stay in vital organs such as brain, liver, kidney, and in kidney for sure, because there is a gadolinium nephrotoxicity or gadolinium condition which has caused scarring and fibrosis in the kidney. So that there is an indication here to check for heavy metals when you get someone who's had multiple MRIs. And we're talking about really as few as 4. And people with cancer, previous cancer therapy, have had many MRIs. By far and away, the greatest number of cardiac patients are coronary heart patients. They have a coronary heart disease or they have symptoms of coronary heart disease. Those patients that already have established coronary heart disease can benefit from chelation. There was a big study done called the TACT study, and there were over 1,700 patients. And those patients that had about 40 chelations over 1 or 2 years, the 5 years following had significantly fewer cardiac events than those that did not get chelation. Now, chelation will not debulk plaque, but it is an incredible antioxidant. And even the American College of Cardiology, American Heart Association, American Thoracic Surgeons Association, in writing up their guidelines, said that chelation can be considered in preventing cardiovascular events in those patients that already have cardiovascular disease.